For the panel discussion, we've invited three practitioners from Edmonton and the surrounding communities to come and share a little bit about their experiences when it comes to this topic, motivating physical activity behaviors. I hope the audience can see this panel discussion as being a very open process. We invite questions from anyone in the audience. We also invite points of discussion or things you would like to share yourself. There is a mic floating around, so just raise your hand, let Betty know if you have any question or anything you'd like to talk about. Before we get started, I'd like to actually introduce our panel. So just to my left here we have Betty Ann Petrak. She works for Alberta Health Services. She's a health promotions facilitator covering the city of Camrose County, and Flagstaff County. And previously, she worked for Chinook Health as a health promotion specialist and Healthy Weights Initiative. In her current role, Betty Ann is actively engaged in her community, in the community partners, and she facilitates a lot of community development opportunities in the rural and urban locations she works in. A highlight has been the work she's been involved in the development of the City of Camrose Workplace Wellness Policy. And this is one of the reasons why we wanted to invite Betty, is just because she is working very much at the community level, so can bring that insight to today's panel discussion. Next we have Pat Sachs-Brown. She works in the field of education for the last 20 years as a teacher, a consultant, program coordinator, and supervisor. And she currently is a principal at Belmead Elementary School in Edmonton and is part of the Apple Schools project. Pat has worked alongside colleagues for the last 2 years to motivate staff, students, and parents to make the healthy choice the easy choice. And the success in her school has come in part from her experiences in promoting change in teacher practice and school culture. So we're very pleased to have Pat come today to bring the perspective of working and promoting physical activity in the school setting. And we also have Lisa Workman. She's an exercise specialist for the Edmonton Oliver Primary Care Network. She promotes physical activity and exercise prevention and management of chronic disease. In her practice, she works with a diverse group of patients with various conditions and comorbidities. She's been active in the exercise profession for 10 years, is a CSEP certified exercise physiologist, an AFLCA group exercise instructor, and an AFLCA trainer of leaders. Lisa also sits on our advisory board for the Wellspring publication, so she's involved in that way as well. And we're very pleased to have Lisa here today to kind of bring the perspective working with the individual, especially those who have chronic disease. So I'll start the panel discussion off, but again, I invite anyone from the audience to come forward with their own questions. And I guess my first question for the panel, and also for Phil, if he can kind of maybe add in, I guess, afterwards, is with your work, what's your own philosophy or your own approach when it comes to the people, the schools, the communities that you work with when it comes to motivation and physical activity? And I will give that to you. It looks like it's on.
Hello? Okay. So for the first question, the philosophy, right along the remarks of Minister Addy's, that says, let's get on with it. That's very much a philosophy in what I have in my daily work as a health promotion facilitator. And then, as Dr. Wilson pointed out, that motivation is absolutely complex. It's complex for individuals, groups, and communities. And so those are key ideas I have to keep in my mind when I'm working with my groups in motivating. The biggest thing I think for my own philosophy would be to maintain a passionate attitude about the work that I do, and bringing that forward in whatever it is that I'm doing. Being passionate about the process and not just the end product. And although most of my work is in groups and coalitions and communities, trying to keep the philosophy of granting everybody an equal say and equal opportunity to be heard, to be part of the process throughout the involvement. As a motivator, to be the source of answers and solutions is another philosophy. If we're bringing something forward to a community, we have to be prepared to have the answers as to the hows and the whys and not just the whats. So really a sleuth in all senses in terms of a philosophy to adopt when dealing with motivating anybody. granting people the opportunity to feel invested, respected, heard, and competent in whatever it is that's set before them. So particularly working with the City of Camrose Workplace Wellness Policy Development, really just walking them through the process of developing it for themselves. So motivating it by making them feel competent in whatever it is that they set out to do. So getting to know the situation and circumstance is also a part of it. The readiness for change, the reasons for change, and the expectation of the change at hand. And basically in all philosophies, in terms of all work that I do, and not just with physical activity, to remember that motivation should not be dictated by fashion fad or any of those sorts of things, specifically with physical activity, and just to make sure that there's always the aspect of wellness and health involved.
Pat, why don't you have a go?
Okay. I work in a school, as was stated, principal there, and the last thing that I want to be is the Tyrannosaurus Rex that we saw on the screen earlier. So my philosophy comes off of kind of two words that I heard years ago. That is one of the greetings that people in Africa say to one another when they greet. They walk into a village, and the first thing they say is Kasarian Ngara. How are all the children? And that is basically the base of my philosophy. How are all the children? Can I say that all the children in my school in Belmead, the west end of the city, high needs area where 2/3 of our population is living in poverty, does not have access because of parental supports or lack of, because of dollars, because of access, as was talked about earlier, to physical activities, to things that will help them to move into becoming healthy and productive members of Alberta. Can I say that all of the children are well? And at this point, we're working at that. We work at that through the Apple Schools project. I don't know how many of you are aware of that project. We're one of 10 schools in the city who is currently involved in this. It's been a 3-year project, and it has had a phenomenal effect on the students, staff, and community in our school. And so I guess when I think about my own philosophy in what do we need to be able to keep that success going, to help those children so that we can say all of the children are well, is to hold a philosophy that strongly believes in making the healthy choice the easy choice. We do that through walking the talk. And I am the first one in the school to think about what am I doing physically every day to demonstrate that I believe that that's important. What do we set up for things within our school so that students have the opportunities to be involved in things that allow them to be physically active? Do we use DPA bins on a daily basis? I certainly believe that they're incredibly important. Do my staff believe they're important? And how do we create opportunities so that they can want to engage more in that type of activity so that it becomes part of the philosophy that they have as well? We spend a lot of time, and I'm a firm believer in building of relationships with and between the staff, with our parent population, with our community, because we know that we're not going to make just changes within the school. So without all of those supports there, particularly for our students. So I believe in that piece of involving people. I am not the one who, again, will make the change. The change will have to come from the culture, changing of the culture. So I do work and believe in working with my keeners, my pioneers, if you want to call them, those who want to get out there and really get the rest of the staff going. But I believe that they're the ones who are going to then engage the others in moving forward as well. I think, too, the opportunities for involvement by our parent population, Certainly, we don't make any changes or any decisions in our school without our parents being part of the process. Because I can put all of the things in place. We're a school who has a nutrition policy. We can put all of those things in place, and I can believe that they're important. They can be part of my philosophy. But if they're not part of the philosophy of the culture there, then basically it's a change that as soon as I'm gone, will be gone. So it's really important to me that we do look at the things that are going well, that we do look at what our research is telling us, and we are involved in research all the time, research with our grade 5s, with walking. I do some focus group work with my students to see what's working, what do they like. I know that when I put apples on the front table at our school, that there's an awful lot of kids who are getting a little bit of physical exercise, getting up from their classroom to go to the bathroom with the excuse, for the excuse of getting an apple. So if apples are bringing them down and getting them up and moving, I'll do it. Because I'll do whatever it takes to help them to get to that point where we can say not only all of the children are well, but all of the community as well.
Thanks, Pat.
I'm very fortunate to work in a primary care network where I work on the individual level with patients. And really my philosophy comes from a self-management philosophy, and that individual patients are in control of their own health. And I'm just there to facilitate and help them through that journey. And so I have a great support network within my primary care network of other allied health professionals who help me motivate patients to move a bit more. So looking at the patient and looking at them as an individual and really what are their preferences and what do they want to do is a large part of my practice. I think I sometimes act as the external eyes to them, that just giving them suggestions and ideas and letting them kind of decide their own journey through their physical activity experience. I act as a motivator as well, but we really want to put it back to the patient, the individual in my situation, because it is them that are outside of my office needing to implement physical activity. So definitely self-management and autonomy, like Dr. Wilson talked about, is a really huge part of my role.
Thank you. Well, let's see if there's any questions from the audience for the panel, for Phil. That's okay too. I have a whole list of questions as well. So let me. I'll ask another one, kind of to keep the ball going. And anyone gets brave, go ahead and just raise your hand. I guess let's maybe reflect a little bit on Dr. Phil's talk today. Was there something that you took from Dr. Phil's talk, or do you have? Did you take something from Dr. Phil's talk that could influence your work, or do you have any further questions in relation to his talk? And really, grab a mic.
For me, the biggest thing that I took was that in the work we do in health promotion, everything has to be evidence-based and best practice. And so knowing that this information is out there and adding to that resource base that we have makes us feel like there are options and there is hope for what we do, and really motivates us to continue doing what we do. So all of it in its entirety was very motivational for me in what I do, but specifically the information on the intrinsic motivations, particularly because I work in groups and communities and such. You often tend to lose that individual aspect, but remembering that each person who's part of that group has an intrinsic motivation as well as a group motivation to be there. So thank you.
I was really glad as you spoke toward the end of your time, and you spoke about 3 kind of key things that are showing that do affect motivation. And as I thought about that, I really thought about some of the things that are happening in the school and through the support of, again, the Apple Project. And so that first one was to support autonomy. Again, that we own this. We own it in a way that each one of us has to take and do our own part. And that's been a key piece for our staff to look at, to talk about, to engage in, to whatever level people have comfort at. And there has been a change. There's been a significant change because of that. Staff have taken on, for example, when we have staff meetings, somebody always provides an opportunity for us to talk during an activity. So they might do a talk and walk, where we bring up hard questions about what's happening with the kids' physical activity, the nutritional policies, et cetera. And we talk about them. So we might do 5 walks around the library, and another group might be doing push-ups off of the wall. So we're trying to do some things where we're staying engaged ourselves and being active while we're discussing tough things, and finding that is really being helpful. The second one, when you talked about to provide a structure, certainly the Apple's framework provides us with a bit of a structure, and that's good. We do receive fundings. We have a full-time health facilitator in the school, which is great. She's there to answer questions. She's there to support staff. She's there to talk to parents. She's there sometimes to give the hard data as to why we need to make some changes. And I think that some of those things have really helped us in moving forward in the school. The other thing is, we do have some very clear goals and expectations. I know last year when I hired some new staff, I was very open and upfront about some of the ways that our school responds to things in the community. We don't provide certain types of food in the school. We don't pay for certain types of food. If we have an event, our food is from the Choose most often, or Choose sometimes. We always add, like we had a winter concert where we had dance involved, so the kids sang in a language, and then parents and kids all got up and danced together, to the Mexican hat dance or different things to get them involved. So we're trying to set some expectations. So when staff come in, we say, this is how it is here. So it's your choice. Do you choose to come to be a part of that school that's going to respond in this way? Because we know that our students' lives depend on that. We do give feedback to one another as well. And that's a critical piece, and I think a really big piece of my role when I see staff taking initiative to provide feedback, not in a way that puts them up on a pedestal, because that will discourage others, but to find that little bit that everybody's doing and give each of them that little bit of feedback that maybe is going to help to motivate them more. And then that whole notion of be and act involved. Having a genuine interest. I think that an administrator in a school can make or break what's happening there. You can stop it really quickly, or you can to help to move it forward, to get it to a place where it's sustained. And so I really am genuinely interested in fitness. I have been my whole life, and more and more so as I move into my mid-50s and start looking at what is my quality of life going to be, and how am I going to respond to activities that I used to be able to do, and maybe I'm not quite as fast or as I use an example a friend of mine uses. He goes, I'm kind of like a Cadillac now. I got a lot of gas. I can go a long, long way because I got a big tank. I just don't go very fast or efficiently. So, but those are things that are important to me and will be. And so when I hear other staff talking about issues that come up in their life with time, or, because that's a big one for teachers, or being able to fit it in, or stress, I listen to that, and I listen to understand them and try to help them find some ways that we can fit things in that'll make it a little bit easier. So thanks for those thoughts, Phil, because they did really get me to say, yeah, I think we're on the right track there.
Phil, I really appreciated the slide on the literature comparing the stages of change and the controlled motivators versus the autonomous motivators. In my practice, and a lot of other exercise specialists who are in the room do also assess stages of change. And a large part of the population that I see are in that contemplation, some pre-contemplators, but mostly contemplation and preparation. And it was refreshing to see the connection between the autonomous motivators being more within that action and maintenance stage of change. And I guess I'm challenged in my practice in finding ways to obviously move those people down the spectrum of stage of change, but also getting them to start looking a bit more at those autonomous motivators instead of the controlled motivators. So I suppose my question to Phil, if I may, is how do we make that transition from the control motivators into the autonomous motivators?
It's an excellent question, and I'm glad Lisa brought it up. There's a couple of sort of points in the literature that we can use to try and address that question. One of the points is, if we look at some of the studies, and the study that I put up today was one example. There are some other examples in the literature of studies looking at stages of change in relationship to different types of motives or different types of goals that people have for their physical activity or exercise behaviors. We do see a reasonably consistent pattern, and that pattern is that those more behaviorally defined stages of change, the action, the maintenance stage, do seem to be associated with the endorsement of motives that are consistent with this idea of the activity, the physical activity itself is personally important to me. I value the role of physical activity in my life. I find physical activity interesting, stimulating, or somehow self-rewarding. There's less evidence to suggest what we can do to alter somebody in terms of their motivational profile from being endorsing of a more controlled approach to endorsing of a more autonomous approach. And the reason why I say there's less evidence in support of that is there's actually not a lot of evidence to suggest that many people, when we ask them, to what extent do you endorse these controlling motives, actually say, yes, I endorse them to a great extent. Now, or to any extent, actually. So if we come back to the slide that I presented in the very early part of the talk, some of the research that we're doing right now is looking at people who are in commercial weight loss programs. And the assumption in a lot of the literature is that individuals who are enrolled in commercial programs likely have motivators or sources of motivation that reside beyond the behavior itself. In motivational terminology, they're extrinsically motivated. And we have been able to find absolutely no evidence at this stage, and we've looked at quite a lot of individuals now in the Southern and Western Ontario region, that people endorse this idea of, I'm physically active because I'm afraid of being punished for not being active, which is sort of the defining feature of external regulation, or I'm physically active because, gee, I'd be really guilty-ridden if I didn't do it. So the evidence to suggest that we can change a motivational orientation from that control to that autonomous sort of type is very limited in the physical activity literature, even if there's any at all addressing that specific question. If we take the question outside of that literature, and we look at other health behaviors, particularly behaviors that are associated with eating or particular behaviors that are associated with smoking, it appears to be, if we go back to the question that John asked, that perceptions of competence is a big issue in terms of making the transition from having motives that are less useful in terms of the consequences that they will maintain over the long haul to having motives that are more enduring and more consistent with the idea of sustained behavioral change. Part of my answer to John's question was that I suspect that there are limits to how competent we can make people depending on whatever type of behavior we're looking at. I do suspect that there are some limits on that activity. And so the other two factors that have come into play are this idea of connectedness to others that Kerry talked about a little bit with reference to the example of his wife, and this whole idea of autonomy. I don't know that there's necessarily any downsides to the provision of autonomy. And the provision of autonomy very often is operationalized as give people choices. Now, I will preface that statement with saying that it is conceivable, just as there are limits on perceived competence, that there are limits on perceived autonomy. And there's a classic study in the psychological literature that has relevance to physical activity but doesn't include a physical activity component by Iyengar and Lepper, where they looked actually at condiments. And the specific condiment was ketchup. And if anybody have ever bought ketchup, you know, you walk into the condiment aisle and there's rows and rows and rows. There's choice personified of ketchup. And the basic idea that they came up with was, well, maybe choice can actually be demotivating. Maybe there's this idea that if we give people too much to choose from, it will actually be overwhelming. There will be sort of a load placed on the mind that is simply improbable for them to deal with, depending upon their level of comfort with the choices that they're asked to make. And in the work that Lisa does, or anybody that works as an exercise specialist, I would contend that, you know, there's probably many different options that you can give a person for either engaging in an aerobic exercise program or an anaerobic exercise program. The question really becomes, do you want to give them millions of choices? And I would answer no, but you do want to engender a sense of ownership over it, so giving them 1, 2, maybe 3 choices seems to be the limit over which people are able to cognitively process that information. So to come back to Lisa's question, there's very limited evidence to say that we can change motives from being highly controlled to highly autonomous, simply because in the literature, when we ask people to rate their level of endorsement with these controlled forms of motivation for physical activity, we don't see much endorsement of them at all, which actually leads me to question whether they're actually particularly useful. And I think there's enough evidence now to suggest that they're very limited in terms of their utility. The stage of change slide that I showed today and the research that Wendy Rogers has done on exercise initiates is very consistent in the idea that these controlling forms of motivation don't appear to have any impact on physical activity, behavioral indices, stages of change, and they don't appear to alter much over a period of time from 6 weeks to 6 months. So whether those are reasonable targets for change or not, I don't know. Theoretically, we would anticipate that providing people with opportunities to exercise their own competencies, encouraging them to engender some degree of self-ownership over their behavior, and encouraging them to find connections with other people in the context of doing those activities is the most reasonable route that we could go. After all, human beings are social animals, so there is the idea that we want to be connected to others. So I suspect that's how I would address that.
I saw that there was a hand that went up just at the front here.
So my question is just about knowledge translation, because we have a panel of practitioners and then we have a researcher. And one of the big criticisms of research is that, does that information get to the people who are very importantly doing work at the front line? So twofold question, Phil, what kinds of knowledge translation activities are you involved in your role? And then for the practitioners and community, I guess 2 parts. What ways do you get your information? What's most effective? This is one way, but are there other ways? And then also, do you get opportunities to share your knowledge with researchers so that we're making sure we're asking the important questions?
Well, let's have the panel go first. We'll give Phil a little break. Does anyone want to take a stab? Okay, perfect.
I'll go with this one. I get a lot of information, Nancy, from, literature that's maybe not necessarily the scientific literature, but based on the scientific literature. So it's more of a summary article, just for example, with probably motivations. So I do delve into the literature if I really pull out a reference and go, Angela, can you get me this? I can't get it online anymore. I'm not a student anymore. But so I do read some of the literature if I can, if I get a chance. But a lot of it is now just summarized for us as practitioners. Provincial Fitness Unit provides a resource, and just being a part of ACSM and all those sort of organizations, getting information from them. In respect to dealing with the researchers, and kind of laying out what we're looking at as practitioners. It doesn't happen as much as I would like it to be completely honest. For the role that I'm in, it's quite novel to have someone in primary health care working with patients coming directly from physicians. So we're just kind of trying to figure that out first, but I'm so excited to do some collaboration to figure out, you know, how can we look at the work that I do within primary care and actually do a bit of research on it to see how are we going to motivate these patients and all the other things that we do within our practice. So it's definitely something I'd be interested in exploring and would like to do more of, just to make sure that knowledge translation is happening, because it is so very important.
Pat, Betty, do either of you have comments you want to add?
I have a few. We are, because of the project that we are involved in, it is part of the School of Health here at the university, and so we're directly involved in research and get research back from Dr. Paul Vogler, I think is how his last name is said. And it's interesting to me, I mean, our research may come back just sort of how are schools doing as a whole, our Apple schools, how are we doing against other schools in the province. We look at the Real Kids survey and certainly gather information from that. One of the beauties of having a health facilitator in the school is they bring to us information. They often find pieces that we can look at. When I have parents who say, why do we need to do this? They can help me out with finding information. Then as a group, our schools do get together and we talk. As administrators, we have our teachers who network a bit. It may not be the information coming directly on motivation here, but it certainly is information that is informing our practice and hopefully helping us to make some decisions. Again, when you spoke in your presentation there about pedometers, our kids do definitely report that they're doing a whole lot more activity than their pedometers show. We know that, but we are seeing gains in the amount of activity that our students are making. And so even though we know that kids report differently than they actually may be, anything that gets kids up to 60 minutes or more of physical activity a day, to me, is a step in the right direction. So,
I'm just going to add that on any given day in our efforts, in our work, we are about 150,000 different research projects for 150,000 different doctors who, in any way, shape, or form, bits and pieces are pulled from research that we do hear about. And how we hear about it sometimes is, for me, based on my previous education experience, colleagues passing it around, really networking, using the base of resources that we do have. The Alberta Centre has been fantastic for many of the physical activity efforts that I've undertaken in my work, and it's just maintaining those connections and finding out who your people are, where they are, what you can get from each one of them, and then figuring out how to use it to the best of your ability. And in terms of the second part of your question about being involved in research, other than our daily bits and pieces that we pull, all too often we're not, unless it's something specific, something unique that's happened that's going on, and somebody wants to know more about it. But for the most part, we in health promotion, other than health promotion being research in itself, aren't directly involved in anything particularly.
Okay, there were several questions there. Just give me one of them and I'll take them one at a time because my memory's not working as well as it used to.
Well, let's just go with the knowledge translation one. So are there ways that you're very deliberate about making sure you're translating what it is you're doing to the communities that are practicing?
Yes.
My second question is, what are they?
Yes.
Yes.
No, I think that one of your first questions was, you know, what is the status of knowledge translation in this field, and I think it's an excellent point. I think that the reality is, if we're going to speak plainly about it, it's something that we've really only realized in the last 5 to 10 years is something that we have to do a better job of. And I think in my area in particular, what I would say that we do a particularly troubling job of is putting things into understandable language. So, we give talks where we look at concepts like, introjected regulation and identified regulation, and in psychology and in most disciplines we have these unique labels that we put on things. So I think one of the major challenges that I face is when we give talks or when we interact with individuals who are not working on the research side of things, but as you quite rightly say, are working in the front lines. Do we have the ability to put some of these concepts into plain, understandable, and useful information for people who are going to use them? And I don't think we've done enough of that, either individually, myself in my own activities, or collectively as a field, since the field of sort of psychology of physical activity was born around the 1970s. In terms of what I do now, there are a couple of specific examples that I can point to in terms of knowledge translation, but I will be very clear that the knowledge translation attempts that we do, we actually hire a professional to do. There's a Knowledge Translation Institute at the University of Toronto, and there's a similar satellite campus or satellite affiliation at McMaster University. And so when we have knowledge that we think is worth translating into useful public information, we actually hire the experts to do it. In terms of where I get involved, as you will well know, the sort of simple answer is, well, I generate some of the knowledge through the research that we do. One of the mandates that we have is for any of my graduate students, and they will tell you point blank that they are the person on the t-shirt and I am the dinosaur, but they would say that the dinosaur is a little bit more appealing on the t-shirt. They would probably print a brontosaurus or something like that, because I'm a little slow in the uptake. One of the things that I asked them to do, and it's very challenging for them, is I asked them to take their findings and to write up a summary document that doesn't use any of the terminological gobbledygook that our field has. So put into simple terms these issues of motivation, put into simple terms these issues of needs, put into simple language things that people can understand, and provide examples. And all of my graduate students have done that in terms of the projects that they've done, and those projects are, so those summary documents are freely available to the participants who provided the data for the projects. Second area where I'm involved in some knowledge translation work is I'm an international affiliate with the Motivation for Educational Research Group, which is centered at the National Institute for Education in Singapore. And the slide that I put up with respect to print media, I may have couched that a little differently and gone with, hypermedia, hyper being, social networking, internet sites, anything basically that we use now to transmit information out to individuals in a usable and a useful format. And as part of that group, from time to time, I will give insight into how we can translate current findings in motivational science into understandable information that has practical relevance. And if you go onto their site, you will see a section that has a how-to, and there's a whole bunch of different topics: how to use feedback, how to promote competence, how to engender positive forms of motivation. And researchers and other academics have tried to translate some of that information in that regard. I have seen in other groups across the country a concerted effort now to try and really push this idea of disseminating knowledge in a usable format. And probably the best example I can give you is the group at McMaster, SCI Action Canada. They have a website whereby they summarize a lot of the information that they've done to identify factors associated with enhanced physical activity in people who are living with some form of spinal cord injury. It's accessible, it's highly usable information, it's interactive insofar as individuals can post questions, there's blogging opportunities, and I see that really as being a potential avenue for some of the work that we do in the future. And one of the studies that we have planned for June of 2012 is an initial attempt to try and take some of the motivational concepts that I discussed today and translate it into a print medium, very similar to the print medium that Jeff Allen's research has popularized. So I don't know if that answers. I thought there was another question in there, but I can't remember.
We have a question back there.
Yeah, I have two questions, one for Pat and one for Dr. Phil. Pat, given what Phil was talking about today, have you seen anything change over, I think it was 20 years that you've worked in the school system? Have you seen anything change that would explain perhaps why children are less intrinsically motivated around active play, whether it be in the school system or even at an individual level that may explain that? And then for Phil, any research or evidence on whether video games are more intrinsically motivating? For instance, there's lots of feedback you get when you engage in a video game, where you're not necessarily getting that feedback when you're playing per se, as opposed to sport. So yeah, Pat and Phil.
So changes.
Is the environment less economy supportive or anything like that?
You know, I've always worked in inner city schools or schools where the parent population has struggled. And I think that oftentimes in those schools we, in the past, have maybe taken oh, the poor kids, you know, we can't do much to help them out. They come, it's, you know, it's a problem, and I'll just do the best I can while I'm here. And I don't want to degrade teachers by any means, because I think teachers do things out of the goodness of their hearts, the goodness of caring, right? But I think that often, you know, getting kids motivated anymore causes us to have to take a good look at how we change. You know, the behaviors that we're using, are we consistently doing things that we've done in the past because they're easy for us as teachers? And because of that, we've become maybe a little bit more sedentary in our ways, a little more set in our ways, a little afraid to maybe look at what's coming down the road in terms of technology. And technology, as you mentioned, video games, and I know that we will have discussions about that, how that's one of the reasons why kids aren't active anymore, because they're at home, they're watching TV all the time, or the parents are working, you know, so no one's home to be there with them, so it's just the easy way out. No one has the time. I think all of those things are impacting kids. Most certainly, I think it was Cindy who talked a little bit about parents coming home from work, you know. I mean, even in my situation, parents may not be at work, but they're dealing with their own stresses, and so they don't have a lot to give their kids. And I think more and more they have less and less to give their kids. So kids look for an easy way out. I think those that have parents at home that are trying to do things with them, that are trying to get them active, keep them active, are continuing to do that. So the change, I think it's changed to some degree, but I don't think it's changed a whole lot in my mind. I think that it's easier to be sedentary. It's harder to get out and get involved. And if money is part of the issue, or if safety, maybe, and certainly in my neighborhood, safety can be an issue for kids out at night, then kids aren't going to be as motivated to be outside doing things that are actually physical. They're going to tend to be inside more, or doing things that their parents are saying stay home because it's safer.
Okay, so John, your question was on the role of video games and its motivational structure, or whether it has any sort of motivating benefits, right? I'm aware of some of Ryan's work out at Ryan Rhodes' work out at the University of Victoria, where he's showing very clearly that, you know, we can use video gaming as a means to promote physical activity behavior. I think for the most part it's been looked at in a very select number, or a select group of individuals. So the obvious individuals that we might want to look at are kids, spend a lot of time using computers for gaming. It might be a way to get them more active. I haven't seen any information yet coming out directly testing whether studies can, whether video gaming can be used to motivate people to be physically active. However, I have seen evidence to suggest that video games do have motivational potency. It's just not specific to physical activity. Actually, the video games that they were looking at were these sort of what I call shoot 'em up video games. Very violent sort of things where you have a sawn-off shotgun and you run around blowing up things, which my neighbor's grandchildren seem to like to play on a number of occasions. And essentially what they found was that basically the motivational lure of these video games links quite nicely with this idea of needs. The idea that you can get better at it, the idea that many of the video games give you options, you can pick this type of weapon versus that type of weapon, or this type of character versus that type of character, and seems to provide a sense of connection with a broader community. So certainly one of the questions so to answer your question, yes, there is evidence coming out of the University of Rochester to suggest that video gaming has a very potent, powerful, and useful motivational side to it. I haven't seen any evidence directly testing that, although I think that things like the Wii Fit or something like that would make a really interesting study to look at in terms of whether it has any adaptive motivational properties. The other interesting part to that, I guess, speculatively would be, does it transfer? So if we can indeed motivate somebody adaptively by using these video games, does it transfer into other areas of their life so that they start to become more active commuters as opposed to passive commuters? In other words, can we use those tools to engender physical activity behaviors through the motives that they develop outside of that specific context? Because I think if it really only engenders motivation in that context, it's going to be limited in terms of its potency, in terms of enhanced physical activity. The studies that I showed coming out of Portugal seem to suggest that if people have these well-internalized motives, which are not just intrinsic per se, but they could be extrinsic and yet very well internalized to their sense of self, that they have very adaptive benefits both within one context and in related contexts. And the context that they demonstrated in one of the studies that I showed was with respect to weight change. The motives that they measured were specific to physical activity behavior, but they also seemed to have effects on dietary choices that led to sustained weight loss. So I do think that something like gaming or the use of video technology in that context could be very powerful in terms of its motivational influence. And I may even go out on a limb and say it may have real motivational significance for kids or individuals that use that technology a lot in their recreational activities and provide very unique, dare I say, novel opportunities to get them active.
We have a question up front here. Oh, over here, sorry.
I'm not sure where my question is now because I've written quite a few comments on my page as well, but my colleague and I work with seniors, and seniors weren't really mentioned much today, and I do appreciate all the information that we've received about youth and adults, and I'd like to see that carry over to how we can help seniors, but I do find that with programming for a community for seniors, that it's not just physical, but it's also mental, or programs that will help mentally and spiritually and help them to support feeling useful. So when you mentioned video games is actually for seniors, I find personally, bridging the gap between grandkids and grandparents so that they have a ways of communicating, because kids talk through video games now. But I guess my big question is, and I won't take up too much time, is how can we compete to motivate seniors when we deal with the loss of their home and coming to a more group community and larger living residence where there's 145 people living there, when physical activity is also a pressure from family to participate, where we do our best to make sure that they feel that it's their decision, but they fight to resist because then they have a choice. And so their decision making is sort of taken away only because out of love from family members, and so we try to do our best to get to know the residents, but because of physical changes that they might not want to admit to. And then how do we motivate seniors to become active when we also go hand in hand with having posters that make sure that they stay safe, to bring your walker, to make sure you have a cane, to watch out for ice. And I don't want them to be scared of, things outside and not participate. But they do go hand in hand with making sure that they do stay safe. And when physical activity becomes or evolves into more social opportunities rather than just being physical, like getting out. When I worked in long-term care, getting out for exercise wasn't just exercise, it was getting out. And I don't want to see, it's a wonderful social opportunity. We've had great friendships evolve from going out and doing our St. Albert Striders walking groups and doing mat yoga and things like that. You have smaller knit groups, but I don't know, I guess it's just how do you overcome the competition when it comes to motivating seniors, like the loss of home and their decision making and their life becoming more scheduled.
Does anyone want to take a stab at this?
I'll go first, I guess, since I grabbed the microphone really quickly. Your question is a good one, and I'm sure that my colleagues up here will have some interesting insights into it as well. You're correct in your evaluation in the sense that I didn't present a lot of information on seniors today. What I can tell you is this: we have in my own research program looked at these issues in seniors, and we see exactly the same pattern. If the motivation is autonomous in nature, the effects are positive. Whether those effects are in terms of behavior, whether those effects are in terms of psychological health, or whether those effects are in terms of staving off the negative effects of ill health, depression, anxiety, stress, wherever those sources come from. There was one interesting study that I wanted to point out, maybe it's relevant. It was actually of nursing home residents in the Rochester area. And the nursing home residents, I can't remember the average age, but I think it was well into the high 70s. So I don't know if that constitutes a senior, but you're the expert on that. You can let me know whether that's accurate or not. And in the study, what they were interested in, they were interested in looking at seniors' perceptions of the staff at the center in terms of whether the staff are supportive of the seniors making their own decisions, and then what effects that perception had on a host of variables. So I'm going to cut to the chase very simply. Seniors who perceive that the staff support their decision making such that they have greater ownership over their life live longer. So there was a very clear relationship between mortality rate and one of the motivational principles that I talked about, which was support for autonomy in a group that I think you're referring to. With respect to your question, which I think is a good one, how do we compete for the resources or the motivational energy, if you will, that it takes in order to get active? And I would say, I don't want to sound trite about this, but I would say do whatever you can not to make it a competition. Because by definition, a competition usually involves some sort of social comparison process where the propensity for negative feedback is high. And there is a lot of literature in the motivational psychology area that suggests that competition, depending upon how it's perceived, it can be a very negative undertaking for individuals in sports, in physical activity behaviors, in education, in political voting forums. So if there are things that you can do to try and reduce the sense that it's a competing resource, I think that would probably be motivationally very adaptive. And again, I would come back to some of the key points that the literature seems to be suggesting. And one is, you talk very clearly about safety as an issue. And I have I best be careful how I phrase this. I have a family member who's just turned 85 and just went through the exact transition that you are talking about. And he shall remain nameless, otherwise if he actually watches this, he will be hunting me down. And he really did experience many of the issues that you quite simply just talked about there, in terms of lack of ownership over his own life, a high sense of control over the things he was allowed to do and not allowed to do, even down to things such as eating. That the time of the meals is dictated because, well, you're feeding a lot of people. This particular individual in my family is quite resilient. And so, by goodness, he just makes his own decisions about what he's going to do. Whether that means he fits in or not is another issue. Safety is a paramount concern. But I would assume, or I would hope, that in centers like the one that you're describing, that there are other possibilities for people to be active that maybe don't involve walking on slippery surfaces, or that involve them maybe all taking their walking aids with them so that they don't stand out and that they do feel a sense of connectedness to those individuals that maybe form a unique group in that case. There is some research coming out that suggests that, being outside in nature is very beneficial. Whether that's something that can be done safely, effectively, and appropriately comes back a little bit to, I think, what the minister was talking about with respect to policy, and what the motivational psychologists talk about with respect to quality of opportunities embedded within the policy. If it's simply a pressurized choice, you can choose this or this and that's it, it's very unlikely to be adaptive in that sense.
Thanks, Phil. I hate to do it because I feel like we're just starting to get the conversation going, but it is noon, so we're going to wrap up the panel discussion, though I invite the panelists and Phil to stick around a little bit afterwards, and please come up and if you have any questions or you want to chat further, go ahead and do that. Thank you very much, and thank you everyone here